I'm Manuel Bornea, an internal medicine doctor in Atlantis. I finished medical school in 1978, went to training and moved down to Florida 34 years ago. And I've been working in the community for such a long time. The way that's been working is, first, years ago, there was no any information how to, when the patient went to the emergency room or was admitted to the hospital, find out if the patient is there or where the patient was coming out. So it was lost information. So through the ACO, we developed a system that through the information that is transferred from the state electronically to be able to find out when the patient went to the emergency room, at that point able to call the ER physician, find information about what's going on with the patient, and exchange information about the patient need to be admitted or not. The patient needed to be admitted, or for the ER physician, you can discharge the patient. I'll see the patient tomorrow first time in the morning, and avoid patient's admission to the hospital. The same way, patient being discharged from the hospital, see the patient within 48 hours, and avoid complication that the patient didn't get the medication, patient has exacerbation of the symptoms, and patient going back to be readmitted to the hospital. So that is money that we save for the patient, insurance, and the state. Getting headaches out of your daily work, that somebody gets into the emergency room or into the hospital and you don't know what's going on. Patient being discharged, you have no information, patient are sick, you don't know what's going on with the patient. So at least you have hospital, can call the hospital, get the information from the hospital, and be able to take care of the patient and continue to care of the patient. Yes, very simple. I'll give you a very typical story. Patient will see in the office, have chest pain, has abnormal electrocardiogram, send for stress test came back positive, send for cardiac cath has normal coronaries. 2 days later, patient goes to the emergency room complaining of chest pain. ER physician notifies, call the emergency room physician, says the patient have abnormal coronary arteries, send the patient home, I'll see the patient next morning. Well, one of the founder members and the seal on the board on the ACO since was started years ago. I think the main thing at this point is we have taken advantage of the electronic communication to be able to give better care to our patient and save money to our community. That's mainly what it is. It comes out to control medicine, control costs, and save money and save Medicare and Medicaid.